Sky News in Belfast.
Well, now more on the future of the NHS and that report by economists, which has found that taxes may need to rise to historically high levels in order to provide funding for the NHS to deal with the ageing population. The report was commissioned by the NHS Confederation, which represents health providers, of course, and I'm joined by the body's chief executive, Niall Dickson. Very good to talk to you. And let me say this, Niall, I mean, in your various jobs over the last 20 years, you and I have been talking about this so-called demographic time bomb threatening the NHS. This isn't new, but there will come a time when it has to be faced up to.
I think we've seen a step change. There's no doubt that the demographic time bomb has been with us over the last 20 years, and systems have tried to adapt. Quite a lot of extra money went into the NHS in the first decade, as it were, of this century. During the period of austerity, obviously, a lot less has gone into it, and that's partly why we're now seeing the system under really very considerable strain. So when we talk to our members, I think most of them would say this is the most difficult time of their careers. As we look forward, and that's what this report did, it looked ahead to the next 15 years, it is arguably more scary than we've seen. So we've all talked about the demographic time bomb. I think the most scary figure for me is the over 85s. So if you walk into any ward in the country at the moment, you will see that it is pretty well. Most wards are full, sometimes too full, of people in their 80s and 90s. That number is going to double in the next 15 to 17 years.
So that says it all on its own.
That says it all on its own.
But this is one of the of it all. This is one of the nettles which perhaps no government, because of the short-term nature of our politics, is really going to grab, do you believe? And they've been talking about this, about clinical and social care, and finding some way to join them up and fund them and stop this bed blocking.
I think the Chancellor's in an extraordinarily difficult position. And in a way, if you look again historically, how have we paid for the health service? Actually, a lot of it has come out of we've spent the same amount, roughly, proportionally, on public spending, but we've spent much less on housing, and we've spent much, much less on defence. And arguably, as this report suggests from these economists, you've probably gone as far as you can. So you can't just keep cutting other services to pay for growing demand for healthcare. Therefore, what is the alternative? They argue more taxation. I don't think it's up to us to say how the government should provide this money, but the answer is, if you're running these services, you can't pretend that you can go on running them on, say, a 2%, which sounds quite good, 2% on top of inflation every year. Historically, it has been 4%. That's the figure for the first 60 years. And all this report is saying is, let's go back to that 4%, and we can probably, with technology and extra productivity, try and meet the needs of this next generation.
But what you're saying is it's up to this government to initiate an honest conversation with the British public and say, we've seen these surveys, and you've seen the surveys that say a penny on income tax for the NHS, and people go, yes, that's fine. We're talking something in the order of 9 pence this time round, aren't we? And that really needs an honest discussion.
By 2033, but
substantial,
we would be richer by that time. So I think that's a very. I think the answer is that if you look at what happens in the next 5 years, you wouldn't be talking about anything like that figure, but you would be talking about perhaps extra on insurance contribution. You might define some of this as an NHS tax, because I think that would be more acceptable to people. But it would be an increase that you would have to pay in taxation if you were going to meet this in the obvious way. There are also other ways government could choose to do it. Theory, it could borrow more, it could do all sorts of things if it wanted to do so. The argument that is made by these objective economists is that actually, in terms of our tax burden, we're not particularly high, and in fact, we are lower than many other countries in Europe, and therefore we could probably afford to increase tax without some sort of economic disaster hitting us.
But it's the honesty of that conversation that has to take place, and this clash then of politics, perhaps some of the smoke and mirrors of politics, the necessity of getting elected, and we generally see, do we not, that parties, that governments get into power by offering to cut taxes, not to raise them.
Well, that's probably true. On the other hand, the Brown initiative in the noughties, as it were, where they did put a penny on national insurance, that didn't result. They won the following election. It was very much identified with the NHS.
This is a step change, though, isn't it? I mean,
so I think that this probably is a step change, and it doesn't. This quandary does not apply to this Conservative government. I think it applies to any government, and I think that if you look at Labour's plans at the last election, they don't go to meet any of this either. So I think all these parties need to reflect, and you're right, have an honest conversation with people about what it is that we need, and if we're not prepared and what we're not prepared to pay for.
Just lastly on it, Neil, I mean, you touched on it, modernisation, reorganisation. Of course, we had a big one 6 years ago now, the Lansley reforms, and there are some kind of hints that perhaps Jeremy Hunt might try to undo some of those. The NHS needs reforming, but isn't it the case that nobody knows what exactly it needs to do it?
Well, there's structural change, isn't there? And frankly, the 2012 reforms are now pretty universally regarded as one of the worst set of reforms. They had very good intentions, but I think the effect of them has not been good. And of course, they were the reforms to end all reforms. Yeah. The problem is that people now think that they're probably among the worst. So there probably is structural change, and there is legislation needed. But in a way, it's below that level that we really need to get this right, and we haven't got it right, which is trying to get services into the community and investment into primary care, that's GPs and that lot, and community services. Those are the services that at the moment are not being able to stop elderly people being sucked into the hospitals.
Neil, great to get your thoughts. Thank you very much.